Piali Day, Ph.D., is a co-founder and CEO of Senscio Systems, a technology company developing AI platforms that automatically make sense of varied and voluminous data to support informed decision-making. Senscio's Ibis platform applies AI to intelligently integrate self-care at home with community resources to optimize self-management of complex health. The Ibis platform is currently deployed in Maine, New Hampshire, and Massachusetts. Piali is the co-inventor of Senscio's patented Scio framework, an artificial intelligence inference engine that contextualizes data in any domain into actionable intelligence. She is also the co-inventor of Ibis, a health management system built upon Scio. Prior to Senscio Systems, Piali was an engineering fellow at Raytheon's Integrated Defense Systems. At Raytheon, she developed a system called Confluence, designed to deliver knowledge-based decision support for public safety missions, pandemic crisis, natural disaster responses, military missions, and situations that require multiple organizations to analyze data simultaneously and respond in immediate unison. Piali earned her bachelor's and master's degrees in physics from Hunter College of the City University of New York with summa cum laude honors and a Ph.D. in physics from Brown University. She is a member of Phi Beta Kappa, Sigma Xi, and Sigma Pi Sigma Honor Societies, and is the recipient of the National Women of Color's 2009 Technology Innovation Award. In 2005, Piali received the Raytheon CEO Award, Raytheon IDS President's Award, and Raytheon Business Development Excellence Award for her work with the United States Marine Corps. I feel honored to have Piali as my guest on the PR Maven podcast today. Welcome to the PR Maven podcast, a podcast all about growing your network and building your brand through traditional and digital networking techniques. I'm Nancy Marshall, the PR Maven and CEO of Marshall Communications. I've been strengthening brands through PR for over 35 years, and now I'm celebrating the success of executives, influencers, business owners, and entrepreneurs from all around the world, all of whom have cultivated their brands and broadened their networks through traditional and digital networking methods. Each week, I interview one of these interesting and influential individuals and provide an opportunity for you, the PR Maven Nation, to gain insights from their strategies and stories. So stay tuned for this week's episode, and thanks for listening. So Piali, tell me about your career and how you got into it in the first place.
Well, first and foremost, Nancy, thank you for the opportunity to have this discussion with you. I'm very excited about it. So where I am in my career, as you know, I am the CEO of a healthcare company that is using artificial intelligence to really transform the way we take care of our chronic health. I got started with artificial intelligence soon after I got my Ph.D. in physics. So that was at Brown University. I was finishing up my Ph.D. when I noticed some work that was being done by Professor Leon Cooper. His background was in the similar type of physics that I was just about to get my Ph.D. in, and he's a Nobel laureate in physics, but he had managed to take his career towards artificial intelligence. And that just got my attention as I was leaving graduate school. So I did a lot of reading and learning on my own. I stayed on a natural academic career, as would have been appropriate back in the late 80s with a PhD in physics. But I was so hooked to this idea of neural networks, artificial intelligence, that after a few years in academia, I decided that is what I wanted to do. So I kept moving in that direction, primarily mostly through doing artificial intelligence in the defense industries. But about 10 years ago, it occurred to me that everything I was doing in the defense industry is taking lots of different data and making sense of it so that a commander-in-chief could make the right decisions, battlefield decisions. We could do the same thing in healthcare. What's missing in healthcare is the ability for each and every one of us to be in full command of our own health. And one of the reasons we are unable to do that is because there's so much data around health that to put it all together and stitch it into a narrative that actually is consistent and holds is a hard task cognitively. So once I made that connection about 10 years ago, I could no longer stay in the defense industry. I just felt compelled to take all my learnings and experience and try to bring it to the healthcare space where I was just starting to understand its inefficiencies and ineffectiveness by looking at our aging parents who were back then struggling with their own chronic conditions. So I left defense, started this company, and obviously never looked back. I love AI. I love solving hard problems. And I feel like I've just always listened to my inner voice and done the things that I felt moved to do. And here I am.
Well, and wasn't the timing amazing that you made that decision and you started your company just in time for this worldwide pandemic?
Yeah, so actually, I would say that we started it a little bit too early. I mean, the world was nowhere ready for the type of ideas we had. And I remember 6 years ago when we first brought the product to the market, doctors would say, why would we want to do this? I mean, I think we're doing chronic care management just fine. Why would my patients want to work so hard at taking care of themselves? Why would I want this information? Because the whole mindset around who has responsibility towards keeping someone healthy with their chronic conditions was still this sort of paternalistic care delivery system that we still live in. But in the last 6 years, we've really started to move away from this paternalistic healthcare delivery to one where perhaps those of us who are living day in and day out with chronic conditions are becoming more leaders of our own care, but in a supported way. Obviously, we can't lead our own care the way a doctor does because there's that knowledge gap and the expertise gap. But I think there is a role. The evolution of the healthcare system will be where you've got the professionals taking a certain leadership role, but you've got individuals also co-leading their own care. And that did not become obvious until a few months ago, because COVID-19, as you probably have read, 80% of the folks who have died are folks with chronic conditions. And in some ways, I think our country is suffering more than other countries because we have not, as a country, as a health system, done a good job taking care of our own health. So we were vulnerable to begin with and were falling victims to that vulnerability. And so now I think we're all coming to realize that we need a different chronic care model, the one that we imagined 10 years ago and completely worked every bit of it, the technology, the care delivery model, even financing it. We even figured out how this gets paid by Medicare. So we were ready. But now I think the country is ready and the world is ready.
Absolutely. And I love the idea of people taking charge of their own health because there's so much that we all can do on a day-to-day basis.
Yeah, we have to, and it's possible.
Yeah. Well, tell me about your company's efforts to help Maine's most vulnerable population and specifically your work with HUD senior housing.
Yeah, so we came to Maine 2014, so almost 6 years ago. And it was fortuitous that we came to Maine. I was talking to various folks, particularly actually investors, and one particular investor said to me, this is a very intriguing idea, but it's so far out there. I need someone from a health system to tell me that if you built this, that they will adopt it. So they connected me to Dr. Richard Goldstein, who from Central Maine Medical Center. He, at that point, I believe, was heading their physician practices. So I called him and he said, let me hear what you are thinking of doing. We had a Skype call and he came down in a couple of weeks to say, I think this is interesting. I think if you built it, we will at least test it out for you. So that was the start of our journey in Maine. So we built the product for Maine And then we've been here since 2014. All the outcomes results that we have been able to show in terms of how we are preventing 3 out of 4 hospitalizations, how we're keeping people aging in their homes at least 2 years more than they might have otherwise done. All of those results were on Mainers. And along the way, we fell in love with Mainers. And I also along the way found out that Maine has the oldest median age in the country. Another thing I learned about Maine is older Mainers are in general poorer than Mainers in other states. So it was a combination of many things, and we never left Maine. So we're deeply rooted in what we do here in Maine. And with the COVID-19 piece, though, I start to worry. Of course, we've got our eyes on the nursing homes, and we see that those are hot spots. But I think as we lower our guards and we all come out of lockdown, there's a potential that the affordable housing communities, and I was just trying to get a count recently, in the 4 communities that where we are, Kennebec County, Cumberland, New York, and Androscoggin, I think there are about 150, 62 plus affordable housing complexes, probably housing somewhere around 4,000 seniors. So these are congregate housing, and I think it'll be hard to kind of keep the disease out of there and protect those vulnerable population. However, if we go in there now and we build up everybody's resilience because they are taking care of their own chronic conditions a little better. So our goal is to build that resilience. And I think we could also just sort of monitor the symptoms of their loved ones before they come in to visit mom and dad and advise them that maybe today is not a good day. Why don't you wait it out? Your temperature is elevated and maybe something's going on. So we can build, I believe, in affordable housing or any congregate senior housing environment, a layered defense where it all begins with the senior being able to take care of themselves the best and building up their own resilience, but then keeping people out and just keeping them safe in their communities. And the other beauty of being in congregate housing is that we could bring services into it because we're serving more than one person. So I really see an opportunity here to keep people safe in congregate housing, helping them take better care of themselves and supporting their loved ones to be watchful and attentive and helpful.
Well, I can totally see how it will work. My mom is in assisted living in Portland in a home that has probably 150 seniors. And we recently got her what we call a grand pad, which is like an iPad, but it's set up for her to do social sharing with her family. But I can see totally how this would be similar if she had an Ibis.
Yes. The social part is critically important, but that clinical part where you are making sure you're taking all your medications in the right way, in the right sequence, you're following your diet. Because one of the things that's happened with COVID is people are not going in for their regular checkups. So you're not going to your endocrinologist, you're not going to your pulmonologist. So your health, if you were balancing it well before because you were more face-to-face interfacing with your doctors, you're not doing that. So that increases your vulnerability to begin with. And then to also just have you be monitoring your symptoms so that your doctors from far away, your endocrinologist could be attentive to you because digitally he or she can see what your glucose numbers are doing, etc. So yes, so the same iPad, but bringing the whole clinical world to your living room and putting you in charge of taking care of yourself, it's got to be the future.
Yeah, exactly. And I would assume that, like, for my mother, I'm kind of her primary family member that watches out for her. So I would be able to monitor her also.
Absolutely, yes. So that through a web portal, you'll be able to see what your mother did, what your mother didn't do. So I take care of my mother who spent 6 months in India, and she's actually stuck in India now because of the COVID thing. I can't wait for her to return. And she spent 6 months here, but she takes care of herself through Ibis. So I know how she's doing. I mean, and before she got on Ibis, I'd call her every day just to make sure that she was still alive, which was a terrible conversation to have, really. And because I'd call, she'll answer the phone, and I'd really want to kind of hang up because my kids are they need dinner, they need homework.
Right.
But with Ibis, I can, the kids are gone, and I can look at it and see she did everything she needed to do. Her blood pressure is good. Her blood sugar is good. And then I can, in a relaxed way, pick up the phone and say, Mom, you're doing a great job. Can we get together over the weekend? When do you want to go to a Red Sox game with your grandchildren? The whole conversation changes from one of anxiety to one of joy.
Instead of, hi, Mom, are you still alive?
Exactly. Yes, I was doing that. And I'd hyperventilate and I'd feel guilty because I knew she went to bed at a certain time. I had to do that before I fed the kids. It was just nightmare. And for me personally, and actually, we built Ibis for our parents. My husband and I actually co-founded this company, and now my mother-in-law is on it. This is how we take care of our loved ones today.
I think it's awesome. Yeah, and that we have the same situation too, because we've also discovered we both have two sons about the same age, and here we now discover that we're also the caregiver for our mothers.
Right. Well, that's how life should be.
Exactly.
And, in other countries where I grew up, you live with your grandparents or your in-laws, etc. Not so much. I mean, things are changing now, but when we were growing up, that's how it was. And I think I would have probably had a level of guilt associated in me to think that I'm not doing that for my mother-in-law or my father-in-law or my mother. But this way I can. It's as far as the important stuff goes, it's as if I am right there with her. And then we physically get together for all the fun stuff.
Yeah. Well, I frequently tell my sons, watch what I'm doing with your Oma, because you're going to do that for me
That's
someday.
Exactly right. Yes. So I'd love to have your mother be on Ibis.
Oh, yeah.
I think everybody who feels like they want to be able to do more for their own health and have their loved ones be more helpful in a timely way should be on Ibis.
That's right. Well, I hear you're working on partnerships with Avesta Housing and the Southern Maine Agency on Aging. Can you share how you're working with those organizations?
Yes, it's been beautiful. So we're in about 30 different senior housing in Maine, and about 16 of those are, I think, Avesta facilities. But just very recently, Avesta decided, post-COVID-19, that they would systematically try to enroll everybody in a housing in one of their houses into the Ibis program. And we've done that now. We've done a first pass to two of the houses, and now we're doing a first pass to 3 other housing. We've been there for, I think, over 3,000 days and just provided tens of thousands of hours of coaching service. So the folks in the Avesta housing that have adopted Ibis are very well taking care of themselves. And part of the Ibis program is there's the technology piece, but there's also a human piece to it. To every member, we don't call them patients because to them, to us, they are not patients, they're people. So they're members of the Ibis program. We assign a member advocate. And this is a person who's going to remove all your roadblocks if they can be removed. And so our members reach out to the member advocates. Our member advocates reach back out to the members. And I believe we have provided over 14,000 minutes of care personally to folks in Avesta Housing. So we're very honored and pleased with the trust that they're placing in us. And in return, we think that we can make their whole communities be safer and more personal. And at Southern Maine Area Agency on Aging, they were the first partnerships we reached out to. I think the non-clinical side of senior care is extremely important, even when it comes to managing one's own chronic condition. So we're working with many of the area agencies on aging here in Maine, but our office is inside SMA. And they work with us to get their Meals on Wheels program, folks on their Meals on Wheels program become aware of the Ibis program. So we're really just partnering to make sure anybody who could use this extra level of support actually gets it.
And you're creating new jobs?
Oh, yes. I think just in the last 2 weeks, we probably hired 4 people here in Maine. So we're creating a new class of jobs called member advocates. And this is it's a professional who I think will become a key member of a healthcare team. They are not licensed in healthcare, but they know enough about chronic conditions to be that first person to talk to when you are worried or anxious or you need an answer to a question. So we are building up this a care team where everybody has a member advocate, but the member advocate has access to nurses that they can go ask questions. So one will be interfacing with the nurse, mid-levels, nurse practitioners, physician assistants, and we're creating, I think, a new kind of clinical role called chronic care specialist. So every member is assigned a chronic care specialist and a member advocate. So these are new roles we're creating in the healthcare ecosystem to bring this patient education, this empowerment to manage your own chronic condition into the home. And that was just never done before. Chronic condition management always sort of was outside the home in the doctor's office. And now we're trying to bring it into the home. So we're creating some new types of jobs and things are going just great. I think those always needed to be there. We just didn't have the means to make those happen before, but now we're doing it.
Well, I love the way this ties in with the whole premise of this podcast, because this podcast is about building your network and your brand both in person and online. And what you're doing is interfacing artificial intelligence with these personal relationships. So each of your members is going to feel like they have their own team or their own tribe of coaches and people who are watching out for them and interfacing with the doctor ultimately, because ultimately you're connecting them with a doctor.
Yes,
through
actually,
Ibis.
I hadn't thought about it that way. You're right. We are extending our members' tribe with 3 or 4 new people. And through all of those people, ultimately, your condition goes back to your pulmonologist, your cardiologist, your endocrinologist, your primary care physician. Their job is to diagnose and treat you. But there was just sort of a Grand Canyon, a chasm between them diagnosing and treating you and your ability to follow through with all of that in the home. And we're filling in that chasm with more tribe members. You're absolutely right. I hadn't thought about it that way, but I think that's a right and beautiful image.
Yeah, so each of your members is going to say, I have my people.
Yes, exactly. Yes.
And that will be empowering.
That's exactly correct.
Yeah.
And confidence building. Yes,
exactly.
I have my people.
I got this. I love
yes.
that. So how will digital health transform healthcare ultimately?
Yeah, so we've always talked about medicine being evidence-based, and it has to be. And I think leading on to this, evidence-based was mostly randomized controlled trials, and all of that is very important because it tells us what's safe, what's not safe, what works, what does not work. But digital health will tell us much, much better and much more quickly as to what works and what doesn't work. It's working with real-world data, and there's natural experiments that are happening in the universe all the time. You and I may have exactly the same chronic conditions, but our lifestyles are different. So if there was data from you and data from me, and the data said, when you manage your chronic conditions doing it this way or doing it that way, one is better than the other. So that evidence base of what really works for chronic health management is what you cannot get outside of digital health in every home. And then, so that's on the individual level. So digital health can figure out, Nancy, this works for you, this doesn't, so do the things that work for you. But at a population level, digital health could say, I've looked at everybody like Nancy. And we can say that for a population, these are the things that work and these are the things that don't work. So I think digital health is the ultimate enabler of evidence-based health, but in a way that we haven't even started to wrap our head around and imagine very well. It's all about real-world data telling us minute by minute what works and what does not work.
Yeah. Well, isn't it great that technology has come so far?
It is indeed.
And will help people live longer, healthier, happier lives.
Yes.
Yeah. Well, we're going to take a short break. We'll be back with more from Piali. But first, we're going to hear a little bit about my new online course on message mapping. And so we'll be back in just a moment.
Do you want to grow your client or customer base? Perhaps increase brand awareness? Maybe tell your unique story more effectively? Of course you do. but you may be worried that you don't have enough expertise to make that happen. Well, no worries, PR Maven Nation. Let the PR Maven herself, Nancy Marshall, show you how easy it is to get your message across effectively using a powerful yet simple tool, a message map. Nancy's training is often called informative and constructive, well-designed and impactful, with a perfect blend of theory and real-life experience. You will leverage Nancy's expertise to create your own message map when you register for this comprehensive online video training course, which is broken down into 4 easy-to-understand modules. Normally, this course is priced at $147, but for listeners of the PR Maven podcast, that's you, PR Maven Nation, it's only $29 when you enter the code word podcast during enrollment. It even includes a workbook and bonus content to guide you through the process. So go to prmaven.com and click on the Message Map Mastery course to enroll today. Remember, enter the word podcast during enrollment for a special discounted price of $29.
So, Piali, what might the future of aging in place look like?
Yes. So aging in place, I think the fundamental shift we will see around aging in place is going to come from 2 fronts. One you actually mentioned around addressing social isolation. And I think we will find that technology will bridge that gap. Not that it ever replaces hugs and smiles in person, but I think we will make huge strides towards building in some level of companionship remotely from people all over the world and just keep that social connectivity healthy. The second place where I think aging in place will transform is we are going to have prosthetics for the brain. Now, we've got glasses, that's a prosthetics for the eyes, hearing aid, prosthetics for the ear, walkers, prosthetics for our limbs. Why not prosthetics for the brain? And what we are building with Ibis is essentially that. As we age and our brains struggle to do the micro planning that's required every single day if you're going to optimally take care of yourself, well, that's something that the AI can do for yourself, and that's a prosthetic component of the brain. The second prosthetic component is what happens when we age. Our ability to recall decreases. But if you have AI in your life and it's sort of tracking everything you've done and understanding what worked and what didn't work, you've got total recall. It's like I tell my kids, when we were little, we had to memorize a whole lot of phone numbers. My kids never had to do it. You just look it up. And I wonder what happened to their brain because they never had to memorize phone numbers. But that aside, if you can look it up, if AI will just tell you, oh, you know what? You want to know what happened at vacation 2 years ago? Let me tell you. That bit of a total recall assisted by artificial intelligence, I think, is going to become a blessing in our lives. So we'll have total recall. We will have a executive planner who will just manage our whole day for us. So I think aging in place will be a whole lot more joyful with AI.
So I'll be able to remember what I came into this room to do.
You bet. Yes.
I hate it when that happens. What did I come in here?
Exactly. When that happens to me, I trace my steps back to exactly where I started, hoping to remember and come back into it again.
It was the paper towels. I meant to go there. So AI will essentially support aging in place because people won't need to have caregivers right there with them.
They will to some extent. If your mobility is compromised, you will need some physical help. AI is not that much of a substitute for physical care. However, the mind piece, some of the challenges that dementia puts on our lives. So keeping the mind more active, albeit assisted by AI, is where I think AI will make significant changes to aging in place. That's why people will be able to stay in their homes extra another 2 years, 3 years. And if the loved ones, with the help of AI, could be overseeing care from far away, well, maybe that'll add another year or so. So I think there'll be gradual increases in aging in place because of AI helping our mind and helping the mind of the loved ones who might be remotely caring for us.
Well, I think AI is going to obviously change our lives in so many ways. I know in marketing, they're talking about how AI is going to impact the future and will help marketers to better connect with their
Sure.
customers.
Yeah.
So it's really great to be able to just imagine
Yeah.
a future with AI.
It'll make us all smarter in everything we do.
That'll be awesome.
Yeah.
So, Piali, is there a resource such as a book, an app, or a website that you depend on, and why?
So I work very hard, but I also read a lot. And the reason I read a lot is because when I'm working, I become tunnel vision. I'm solving a very specific problem. I'm drilling down. I'm just staring at a very narrow space in the universe. And then I just have to, my mind has to break free from it. And when that needs to happen, I just read. And I read every day. And I read everything. So I kind of have two character traits that dominate my life. One of them is curiosity, and I'm curious about everything. So when my mind needs a break, I will pick up the New York Times. I cannot spend a day without it. But when I pick it up, I'm reading every section of it. I'm randomly flipping it, and I'm just satisfying my innate curiosity to just know what's going on in the world. So I do that. I depend on that, and so the newspaper, but not so much for the news of the politics. Obviously, I read all of that too, but just in general, art, music, even sports, anything about science. So I just pick things up in a broad base. And that frees my mind, but it also actually meets a craving. My mind loves to connect the dots. I love to see connections between art and sports and everything. Everything's connected. And so I read a variety of stuff, always through the New York Times every day. But then I read the Atlantic magazine. I read the New Yorker if I have time. I used to read a lot of books, but I just don't have that sustained, persistent energy anymore. So I just pick up stuff that I can read rather quickly, but then always seeking to connect the dots. I don't use a lot of tools because I'm on the computer all the time anyway, work-related. I haven't gotten into podcasts yet, and I don't know why. So maybe I will. But I do read voraciously, and I just read everything.
Well, that's great. I believe reading is the tunnel that opens up our lives to so many possibilities. And I think it's great as a parent to read to your child, too. And
oh, absolutely. Yes. I miss those days.
I do too. I used to love that. Although I started my business in 1991 when my kids, well, actually, it was just before my kids were born, but I remember the early days of my business, and I would be reading bedtime stories to them, but I would be the one that would fall asleep.
Yes.
And then they would go get their dad and say, Daddy, Mommy fell asleep while reading to me.
I recall exactly those moments. And it eventually became that, it became so predictable that I would fall asleep that my husband did become the primary bedtime reader.
Yeah, right. Yeah, those are good memories. So, Piali, how can people get in touch with you if they want to keep or start a relationship or a conversation?
Well, I think the biggest relationship to start with us is to join the Ibis program. So if you have a loved one who has Medicare as an insurance, because Ibis is a covered Medicare benefit, and just could use some extra help taking care of their own health, go to ibisprogram.com. And I think that's my fundamental relationship with everybody, because that's my mission in life, to be able to help support everybody who wants to do better in taking care of their own health. Outside of that, you can always reach me at Piali at SensioSystems.com. I do read every email. I do reply to every email, albeit maybe not on that same day. I'm usually burning the midnight oil, trying to catch up on the emails of the day. I am curious. If you write to me, I will be curious and I will be responsive. But most importantly, sign up for Ibis.
Okay. And Ibis is IBIS. And Piali is PIALI
at Senscio Systems, SENSCIO systems.com. And with the Ibis, it's IBISprogram.com.
Okay, ibisprogram.com.
Yes.
Well, this has been really great. Thank you for joining me today. And I'm sure everybody will want to learn more about Senscio and about the Ibis program. So thank you.
Nancy, thank you very much. I totally enjoyed chatting with you. I love the work we do, and it's always a pleasure. Thank you very much.
Well, I just need to give a quick shout out, too, to the person who introduced us to each other, who is Patrick West. And I met him back in the 70s when I was working at Camp Merrow Vista in New Hampshire. And he was one of my campers. And we have sustained a relationship over all of these decades. And we both had the same love of life, and we shared our enthusiasm and passion. And to this day, we're still friends. So thanks to Pat for introducing us.
And I'll echo that. Patrick is one of my closest advisors and I would say a friend. We're in this together. What we're attempting to do is transformative. So we all just need to come together and do our bit, and we're doing it.
Well, great.
Thank you.
Well, thanks, and have a great day, PR Maven Nation. That's it for this week's episode. I'd like to thank you for listening, and if you feel that you've gotten value out of today's conversation, consider leaving a 5-star review on iTunes or whatever app you're using to tune in. If you haven't subscribed yet, you should do so. I release a new episode each week, and subscribing will make sure you get an alert when there's a new episode. You can also join the PR Maven Nation by going to prmaven.com/nation and clicking join. It's free, and it's a great community of like-minded individuals who are all looking to learn and grow from one another. If you have an Alexa-enabled device, be sure to add the PR Maven Marketing Minute to your daily flash briefing menu. Thanks again for listening, and have a great rest of your week, PR Maven Nation.